Greetings, colleagues. We are here today to discuss telehealth, telemedicine, and telehealth nursing. Telehealth involves utilizing comm systems for the assessment and management of patients. Telehealth can connect providers to providers, providers to patients, and patients to other patients. Telehealth harnesses the convenience and pervasiveness of modern technology communication services to connect those who are geographically or otherwise cut off, maybe due to mobility issues or a pandemic, to health services. Telehealth is an umbrella term that describes using technological communication systems covering many different health-related services. And telemedicine and telenursing would be included in those services. Telemedicine is the diagnosis and management and treatment of disease in patients using telehealth services, and telenursing is the delivery of nursing care through telehealth services. Other examples of telehealth involves televisits, teleconferencing, teleconsultation, telemonitoring, and telepresence, and telemetry. Some of the benefits, risks, challenges, legal and ethical practice considerations. Some important benefits of telehealth include its impacts on goals of improving population health outcomes by improving accessibility and reliability and decreasing healthcare costs. There are some security concerns regarding HIPAA compliance related to the ability to supply a security audit for teleconferencing calls or other telemeetings. Ethical considerations include actual access to the technology itself for populations where they're geographically isolated and cannot afford the technology. Also, there is education deficits that are, can also be related to age or otherwise other factors involved. That should be accounted for since it is not ethically correct to hoist more stress on people who do not have access or education that would benefit the use of telehealth services. Let's see, based on the areas of opportunity in the organization that I work at, I think of two types of situations. One where we have patients that are waiting to be placed, and they are slated in a room for many weeks at a time. And then I also think of patients that are waiting for dialysis chairs who end up having to stay in the patient room for weeks at a time without very much interaction. I think that these weeks of being sort of in limbo can be optimized using telehealth services. For example, I think that while waiting for a chair, dialysis patients can use telehealth services to educate themselves on or coordinate care with their providers on the potential of home dialysis treatments and how to manage those, as well as caregiver education for dialysis patients. Also for management of chronic opioid use. I think for some patients who are physically debilitated, there could be an opportunity to work with recovery and addiction services, or be connected to a sponsorship or drug support group services. Also opioid management education, and instead of just sitting and waiting for next steps. So yeah, these are some of the things that I think. Thanks, guys.